Good afternoon, and you're all very welcome to the publication today of the HSE's Corporate Plan, covering the years 2021 to 2024. This is a launch to our stakeholders, of which I gather there are almost 400 on the line now, and you're all very welcome. It sets out the HSE's vision for changing and developing the health service over the next few years. It's been developed by the board, and we'd like to welcome several members of the board here this afternoon, but its content owes a huge amount to research and conversations and consultations that we've had with a whole range of different stakeholder organisations, 300 different groups that we consulted with, including our own stakeholder engagement forum as part of this process. The pandemic, oddly, has led to sort of much greater stakeholder engagement, I think, by the HSE, and we are expecting that to continue over the next period. So this is the first of a number of conversations that we will be having with you about the corporate plan. A recording of this is going to be made available afterwards, and we'll be emailing it to people with a link. In a second, I'll hand over to Kieran Devan, the chairman of the HSE, to introduce us, and Paul Reid, the chief executive, to go through the detail of the plan. A number of people with different areas of responsibility in the HSE are joining us to answer questions you may have. They include the National Director of Human Resources, Anne-Marie Hoey, the Chief Clinical Officer, Dr. Colin Henry, the National Director of Community Operations, Yvonne O'Neill, and the Chief Strategy Officer, Dean Sullivan, who played a very major role in bringing this project to fruition. So, firstly, I'd like to hand over to Kieran Devan, the chairman, who's going to introduce the afternoon.
Thank you, Mark, and welcome everyone. Just a few words from me. But before I talk about the plan, I mean, the most important thing I think I probably want to say is thank you. And thank you to every individual, every organisation on this call and beyond, because we've all been through a year like no other together. And I think that increased collaboration that Mark alluded to has been part of what has allowed us all to get through this in as good a state as we possibly could. So thank you for the creativity, thank you for the sort of commitment, the hard work, and the sacrifice as well, because I know it's been really, really hard on a lot of people. So on behalf of the board, first of all, thank you. And also from on behalf of the Minister, we had the Minister at our board meeting in maybe 5 weeks ago, and he made a point of asking me and us to say thank you to everyone who had been so constructive over the last year, and that will continue. I think that's the style that I think we as the board, and I know Paul and the executive want to make sure the HSE has going forward. So the board's appointed by the Minister, of course, and we hold Paul and his team to account for the delivery of the plans of the HSE. So it's about supporting, it's about guiding, and it's also, if necessary, about challenging. But I think if we think ahead to where we need to get to, one of the good things about this corporate plan is it's multi-year. So yes, we have the service plan, but also we have this kind of 3-4 year view now of where we want to go, consistent with Sláinte Care, of course, but also recognising that the HSE we need going forward is not the HSE that we've had in the past. We went into this pandemic with the European Commission publishing a report which said that Ireland had the fastest improving life expectancy of any country in the European Union, and that the population of Ireland reported the best health of any population in the European Union. But of course, with that success comes a system which is stretched, which is running hot, which needs to adapt so that it is right for the population demographic we have going forward, with more older people, with more comorbidities, and how we handle that is a fundamental challenge to the HSE and to all of us who work in the wider health system. So what I hope you'll see in the plan, which Paul will take us through in a second, is 6 priorities which we believe, having spoken to many hundreds of organisations and many thousands of people, we believe will help make that shift, which will allow us to deliver the best possible care for the people of Ireland and be as effective as possible in spending the taxpayers' money. So we need to be able to demonstrate to the government that the additional money they've given us over the last 12 months some of which is directly COVID related, some of which is around change and transformation, that delivers on the promise and then justifies the increased investment going forward. So that's the idea behind the plan. Again, thank you for everyone who has been part of making this plan, and hopefully you'll recognise some of your thoughts in it. And with that, I'll hand over to Paul.
Thank you, Chairman. And can I just very briefly, before I kick through a brief presentation, endorse the Chairman's thanks at the start of the presentation. From my perspective, working with a wide range of key stakeholders, many of whom are represented on the call today, it's been a great pleasure over last year. And I think whether it's been with our trade unions, our Section 38, 39 organisations, voluntary organisations, not-for-profit organisations, homeless organisations, patient advocate groups, I think a few things have really, strengthened the health system last year. It's always very hard to find anything positive about COVID, but if we do look back, I think firstly, the way as all of our stakeholders and ourselves have worked together to solve problems, to put in new solutions, to protect the public, has been really important to the public, because I think in doing that, during the course of last year in COVID, we have plenty of information to track that we did strengthen the public's trust in the health system. We strengthened their trust and confidence in how we were trying to protect the public. And we do know that we became a very trusted health system overall, and people sought our protection through the health system and through the health service with the wider partners we delivered. And the final thing I will say about that is I also believe what has helped build that trust and confidence has been, I think, the public heard a more coherent, unified voice from the health system. And we will always have differing challenges, and we will always have differences. But I think from the public's perspective, they heard a much more coherent voice where we had one big goal, which was to protect the public and save lives. So I also want to thank all of you for your efforts, contribution, commitment, and indeed, as the Chairman has said, sacrifice during the course of the year. Thank you very much. Very briefly, I'll walk through the agenda, as you just say, touch on the engagement process, set out the aims and objectives, what we're trying to achieve with the board, and then strengthening the organisation overall. Okay. I just want to move through and just set out for you here briefly, just in terms of the plan overall. As the Chairman has said, a very ambitious plan that we're setting out to achieve. And there's a few key points I would take from it. First of all, it is the first corporate plan of the new board of the HSE, which, as the Chair has said, is a very different governance process, a very welcome governance process from myself as CEO, to have a board in place over a €21 billion budget. Secondly, I think we want to do is leverage all of the good outcomes from this year in terms of protecting the public, protecting their well-being, and there's many lessons from it. Thirdly, just to touch very briefly on which are the values of the HSE, and indeed the values that I believe the public experienced in great strength last year through the care and indeed through the support that you've given us between care, compassion, trust, and being a learning organisation and learning from what's worked and being honest about what hasn't worked and what we need to change. So a few issues that I will be bringing through the presentation, which are the priorities in the plan, is facilitating people to remain longer in their life and having their care closer to their home, living in their communities in a much more sustainable way, being able to provide that care at the right time for the right populations, for the right services we have to provide in the right place. And then thirdly, a strong team, which will come through the corporate plan, is around the whole issue of integration. I mean, many organisations talk about working as one team, but from our perspective, it is about what the patient, what the public, what the service users experience in terms of their care across the whole system. And then finally, a really core priority for ourselves and the HSE is around the whole issue of strengthening, building the trust and confidence that we know we've made some progress on last year. And finally, as the Chair has said, there are 6 priorities which I'll walk you through very briefly. They're not exhaustive, but they were what we believe was the right ones to put a particular focus, a particular emphasis and a particular investment in during the course of this 3-year plan in particular. So I'll walk you through just very briefly, as the Chair referenced, we did, and I want to thank you all for a very extensive and engagement process throughout this. Obviously, it became more difficult, or we had to certainly do it in a new way during the course of COVID, but we did start early last year prior to COVID restrictions, where we were able to engage in a number of public engagements with staff, with many of yourselves as stakeholders. Myself and many members of the board attended those, and very strong teams coming back. Also, in terms of online surveys, very significant surveys coming back from stakeholders and even from staff, and many online ways that we sought your views. The one thing I'd say coming through strongly across the teams, interestingly, particularly those public-facing ones we were able to engage on, yes, waiting lists, and yes, access to care was a real priority. But other priorities that came through very strongly were things like integration. How do we make sure and align across all of the service providers that the experience of the patient and the person using the service is reasonably seamless, and it's not a handoff, but more a handover across the various aspects of our service. And the other striking piece that came back through strongly was the whole issue around local services and how much people valued services in their community. So just interesting themes that came through apart from the ones we might expect. So briefly to touch on our aims and visions, which I kind of touched on the first slide, but you'll see it presented here in this very simple infographic. It is about the core priorities from Sláintecare, which is government policy. It is for the first time an all-party agreed policy around priorities for healthcare for the future. And they're not cliches. They are about actions we've started to put in place during COVID that we want to build on for the next 3 years around the right care in the right place for people's needs. And it is, as I stated at the start of the presentation, it is about all of our services, all of our providers working together in a very coherent way from the patient's and the public's perspective. Move on. Very briefly, it might be difficult to just see in the infographic as we have displayed here, but I just want to, at a very high level, and take you through each of these individually, but at a very high level, the 6 priorities that we have identified, the board have engaged extensively on, are around what is it that strengthens our society in terms of how they experienced our health services. And if you walk through, I guess from a patient's experience or the public's perspective, first of all, we know we need to manage our health service with COVID in the coming period, certainly throughout this year, and most likely we'll have to manage pandemics in the future. Secondly, we want to look at people's access to care and what initiative and actions can we put in place to strengthen people's access to care that they need and waiting lists. Thirdly, we know a very key benefit is around primary and community services in the community. How do people access their care locally? And how can we have a seamless integration between acute and community services? And fourthly is around mental health provisions. And I'll bring you through some of the key actions in that. But it is about early interventions. How can we strengthen them at a local level? On disabilities, in a very similar way, how can we become more person-centric in terms of our services, and always remaining focused on the experience of people living with disabilities and how we're providing their care. And finally, a key one that we have pulled out together with the board are the areas that, as a health service, we may be outliers on. And evidence and all research which we have shown demonstrates us, of course, certainly early interventions for children, other areas even for adults and children around obesity, and also around alcohol and its use and abuse. And then I will touch briefly on a few of the key enablers, how we use data, how we strengthen our infrastructure investment, and how we strengthen our investment in people. So the first objective, just to summarise, it is around continuing to manage our health service in a different way, the way we've had to put in very, if you like, dual pathways. And we know we will have to sustain for some period of time. it is about building a pandemic capability. And we referenced some of them here just around testing and tracing. But first of all, we need to make sure that we have that continued engagement with the public about the risks of the virus at various stages that we're at, about the knowledge and information that they feel and they've demonstrated to us that the public need from us and trust from us. Issues like testing and tracing and our investment in testing and tracing for the future will be key. And it's not just about testing and tracing, it is about public health. It's about a whole range of measures that we have to put in place to have what we call a pandemic capability for the future. And that may be a workforce and a capability that we have to scale up and scale down at different times. But we know we have to be able to respond. And not many health systems were proven to have a sustainable pandemic capability at the start of this. And we are no different. We know we didn't. So we've had to build things from scratch. Finally, in terms of just the safe, effective administration of the vaccine programme, we're not covering it in detail here today. We did last week at our National Service Plan launch. But we are making really good progress. We are a function of supply, but Ireland has a good reputation around vaccine administration, vaccine take-up, and we have no doubt as we work through this period, we will prove to be one of the strongest take-ups of the vaccine administration and one of the safest. Secondly, just in terms of the primary care and community services, I guess if there's one of the strongest lessons we all need to take away from the COVID period has been the benefit and impact of providing services locally, where the population have always told us they value it, they need it, and they want it. And particularly thanks to yourselves for much of the innovation, for many of our stakeholders, for much of the innovation put in place to address particularly vulnerable people, but also to put in place pathways of care. So the emergency department or the hospital was not the first port of call in terms of people's health experience. So issues that we've put in place are initiatives around strengthening and valuing our GPs and working with our GP practices, working with our primary care centres, resourcing effectively, working with service providers like many of you who are tuned into this call today. So some big priorities we have around strengthening that investment in community health networks. A very key commitment in Sláintecare, very key commitment in our corporate plan, and indeed a very well-funded commitment around 96 community healthcare teams and 32 community specialist teams working on chronic illnesses, older people needs in the community. Diagnostics. Thankfully, in our winter plan, we've had a very significant investment in GP diagnostics, facilitating people to get their care without having to go to a hospital system or indeed becoming on a very long queue. We want to build on the GP working this year in terms of the agreement and support for chronic illness management in the community. The department and policymakers are working on a statutory home support scheme. Again, the investment in home supports have proven invaluable this year. And we do know that the investment that helps the hospital system are some of our step-down care beds, both in terms of intermediate step-down and also rehabilitation beds. And finally, we all know, and we have all experienced some of the awfulness through the mortality that we've experienced in nursing homes. And we can all put our hand on heart, and we've been very public to say we all have to learn lessons about what we could have done differently, what we need to do differently in terms of elderly care in congregated settings for the future. And the expert panel sets out some of the key objectives for us. Thirdly, just want to touch on the around timely access to care, which we know very well and you have all experienced some of the frustrations of the public around waiting lists and how we tackle people's long-term needs. And certainly there are ways committed in plan and in our corporate plan that we know we can go about doing this. Firstly, we know that we need to move from a very siloed approach to how we address the waiting list. And there are very new ways we've put in place in the COVID period where people are attending for outpatients, not in the hospital system, but in the community, or indeed in places like City West, where we're addressing many of our waiting lists for children and adults. But we do know we need to increase our capacity across the public system to address this. So looking at areas and configuration around dedicated centres for elective care in the future, providing additional capacity into our public system, and indeed utilising the private system and privately funded operators, how we've engaged with in a more beneficial way this year. Thirdly is around the whole area of planning scheduled care reform and investing in some teams at a national level to support local services tackling this problem. Fourthly, there's a key one here around what we call health visualisation platform. And in summary terms, and I've seen this in operation in a few pilot hospitals, we ran it in Kappa Hospital, NACE and some others. And it is in essence using data around the efficient use of our theatres, the scheduling of our theatres across consultants for very different consultancy practices, how we have that done in a more effective and efficient way to get the best and productive use from our theatres or our scheduling of outpatients. So we know there's a lot of data that we can draw on better for that. And finally, looking at a system that makes it facilitates the experience of the patients much better, but also helps us to address where we know we're getting the efficient use of the services and we know where people are not showing up, that we can use that capacity wiser as well. Fourthly is around the whole area around prioritising the early interventions and improving access in terms of mental health. And there is a very well-defined policy from government around sharing the vision and mental health policy for everyone. And there's a number of actions in that. Thankfully, with our service plan for the first year of our corporate plan this year, are funded. So we know that we need to strengthen, and again, some great work done in COVID about people's mental health needs being met in a very different way. I visited the eMental Hub facility in Castlereagh and Roscommon during COVID, where people were getting their mental health services, clients were getting their mental health services in their community and at home. And indeed, the feedback from many of our consultants engaged in that process was that they were actually getting better insights into people's experiences in their home. So we know there's a lot we can do. We know we also have to resource up our children and adult health systems, mental health systems, to give greater levels of services across the board, and also that we strengthen them at a local level. Okay. Fifthly, just want to touch in a similar vein on our disability services. And we know we've many challenges from a funding perspective across many of our disability providers. But we also know, again, the strategic direction in terms of looking at this from a very person-centred perspective, looking at from the people who are living with disabilities and their disability healthcare needs. And also the commitment to moving people from congregated settings. And I've seen in practice, indeed working with many of our service providers, I've seen many of the benefits of people's lives moving from congregated settings into supported accommodation in the community. And it's just transformational in terms of what I've seen, what I've experienced, and what the users have fed back to me of their experiences too. So we know the common priorities. Again, in our service plan for the first year of this corporate plan, we have some extra funding too. Final big sixth priority is around prevention. And everything we know about this year has told us that the experiences of interventions at an early stage in the community and how the public value their health system as they need us. And we know also, we've identified in our corporate plan, some of those priorities have to be around some of the outliers that we have experienced. And Kieran, at the start of the presentation, Chairman outlined many of the positive outcomes from our health system. And we need to now to focus them towards some of those areas that we know are in outliers in. So children's health, access to care for children's needs at very early stages. And again, we do see the community health networks being key in terms of provision of those services. That's the local where we know the knowledge, we know our people, and certainly our local staff know their needs stronger. Secondly, in terms of the obesity and the models of care around obesity, looking at that in an integrated way. Traditionally, or heretofore, maybe a lot of the interventions happen at an acute hospital system. And we know it's across the board in terms of where we can provide much better integrated care for obesity. And thirdly, around alcohol services. In essence, providing those services locally, and again, we do this through many of our partnership organisations, how we can strengthen that collaboration, how we can strengthen that resources in to address this really key issue for our society. Plan also identifies a few very significant, important, what we call enablers for us in the health system to help us provide those priorities in a better way. And very simply, the experience of the patients and people using the service are really key for us, that we really understand their experiences, their priorities in terms of how we design services, how we co-design services. We also know we have to strengthen how we have a much more open culture, a much more transparent culture. Many reports in the past, whether it's from Scally and other reports, have demonstrated the need for us to step up in terms of openness and transparency and patient engagement and listening. And we are committed to this. It's something our board puts a lot of priority on. We have a dedicated subcommittee of our board on safety and quality, and we engage significantly on those priorities. Second area is around data and information, and very briefly, we know that there are ways we have a lot of data in the health system. The challenge is we don't have it in a single integrated way that we can use the various bits of data that we have to inform the design of our health services, to inform our priorities. And one of the learnings for me, particularly in COVID, was that as we captured a lot of data from testing and tracing, as we're now capturing a lot of data from a vaccine rollout, is to have what we call a data lake, one single repository where we can capture all of our data and do the analysis in a much more integrated way to inform us for the future. Similarly, on technology and e-health, huge advances made during COVID period in terms of utilising technology, whether it's how we engage with people, some of the remote clinics we've had to put in place through telehealth, but also through e-health initiatives. And there's been many initiatives we've put in place during COVID that we can build on. And there's one or two that are really highly rated in international health systems. I mean, one of the ones to reflect on is during endoscopies, where it proved difficult in terms of infection prevention and control during COVID, the deployment of pill cams, where we were able to literally a pill can identify, and a camera can identify some of the key issues, and remote monitoring of that too. And similarly in COVID, a lot of remote monitoring of patients with respiratory illnesses to help with discharge from hospital. Communication and engagement is something that we really value and want to strengthen and build on. We believe we've made some good progress with the public, good progress with our partners throughout last year, but we want to strengthen and continue this both internally for our staff and externally with yourselves, many of our national service providers too, and local providers. And finally, on infrastructure and equipment, we have a very significant budget this year on capital investment. It's just about €1 billion. And that's a very significant investment for us. And we do a lot of very big strategic investments quite well. Yes, we come under criticism. Health system comes under criticism in terms of Children's Hospital. But if you look at many of the projects the Health Service Executive has overseen, some really big strategic priorities delivered over the course of last year. The National Forensic Mental Hospital in Portrand on Abate, the National Rehabilitation Hospital, 120 extra beds in a new unit. Really key big projects delivered, but also local projects that are important through some minor capital investments also. Okay, just in terms of looking inside at our organisation and our people and our staff and also our stakeholders, we do want to be very strong what we call investing to win people's hearts and minds, because it's not just about the investment, but that is important. It's equally important that we know winning the hearts and minds of our people, of our staff, of our stakeholders is equally key. And we know that during COVID, we've had to do that in a very different way. And there's many learnings that we've done by being able to do it differently that we will build on for the future. But I guess the key big objective here that we set out in the corporate plan is around developing a strategic workforce for the future. And we've always had some level of recruitment in the health service, and we've had a significant level of recruitment. This year, we've over 7,500 people recruited in 2020, net incremental recruitment. But certainly for next year, we have very significant, and as part of the 3-year process of the plan, of a strategic recruitment workforce planning, 16,500 extra people to be recruited next year is the first part of the plan. Nurses, doctors, medics, and across the board, community services, a lot of our therapists, and some management and admin that people need in the service. But we also want to make sure we have the supports for our staff, for our providers, around some of the challenges in terms of that our experience that people have had, not just during COVID, but in the delivery of healthcare. But also creating that strong work environment, that environment within the health system of people being valued and people being excelling in their work overall. Within the HSE, a particular strong objective we have been working through the board is developing a high-performing organisation. And all across the HSE, I have witnessed people who go above and beyond what could be expected in any organisation. And I made the point many times publicly. I've worked for 30 years in the private sector, and I've seen a pace of change implemented within the health system with all of our stakeholders last year. I've never seen so much change implemented by so many in such a short space of time with such a wide benefit. And I'm very proud of what I've seen, of what we've all mobilised to do. But we do know that we equally need to strengthen parts of our organisation, both in terms of our culture, how we live by those values that are important to us. We know that we need to strengthen accountability. And one of the early experiences I had when I joined HSE was we need to strengthen who's responsible for what. You know, there's many times we might have 3 different names or 3 different divisions where we might have to go to. We need to create greater clarity and a greater accountability for delivering. And equally in terms of performance management, we know that we need to strengthen our performance management culture in the organisation. And we need to value people who do a great job and go well above and beyond. But we equally need to, and many people have reflected to me, we equally need to tackle underperformance and not be shy about tackling underperformance and have a good process to do it. Also on our risk management, we know, and you know, managing health systems has many risks, and we will not be able to give absolute assurance and reduce all of the risks. But we do need to mitigate them to the greatest extent possible. We do need to have a good lens and focus around what risks are becoming more urgent than others and which risks need our attention. And we've spent a lot of time, and our corporate plan commits further time to strengthen our risk management process. And finally, a really important one for us that we made really good progress on over the past 2 years. For the past 2 years, we have delivered our budget at the year end at what we predicted it would be at, which is a very important priority for the public who fund us, a very important priority for government in setting their priorities and budget allocations. And we have secured this year, as the first year of our corporate plan, in our national service plan we launched last week, we have secured from government an extra 21% of budget for the HSE, an extra €3.5 billion, bringing us to €20.3 billion. And that's important, and it demonstrates that government, we have one trust in government around priorities. Government equally value the investment that has to be put in the health systems. And we know that those funds were put in at a very time and a period of very difficult economic stability for the country. So I think we all value that. The big challenge for all of us is, and working together, is to get the best value for that money and to make sure that we use the money effectively and wisely, and patients and users' experiences are improved. Okay. You may not be able to see this graphic too clearly, and I won't labour too much. It is on page 34, I think, of the plan overall, but there's a few points I just want to make on it. We certainly do want to continue to be a very agile organisation. And I think we have demonstrated that working with many of our partners, working with through COVID and previously. We also know that we need to make decisions, and we need to make decisions quickly and promptly. One of the things I've been very public about is during COVID, we knew we had to make decisions quickly. We know that probably we'll get about 70% of those right, probably we'll get 30% of them wrong, but we need to be clear and transparent about that. And just a few other ones I would say there. We're not a policy organisation, that's the role of the department and the minister. But we need to be able to put policy into action, and we need to be equally be able to inform policy. So we need to strengthen our knowledge and engagement as policy is being formed. And finally, just one point I want to mention here is our board have put, with our board, we've put a very strong process of oversight, how we're going to oversee the corporate plan. We have a strategic scorecard now, which monitors all aspects of the corporate plan and the service plan throughout, and we'll report against that. So in closing comments from myself, just to make a few very brief points. One, I do want us to build on all of the learnings working together to be action orientated, to make decisions, to move quickly and promptly and agile in ways that we do it that mitigates the risk associated with it. Secondly, I do want us to continue, and the board wants us to all continue to be a strong learning organisation. We spent a lot of time with our board mid last year looking at the first wave of COVID and what were the priorities and the learnings that we made from that to help us through. And there's no doubt they help us in the second wave. They help us in the third wave. Thirdly, we want to make sustainable and real changes to how the public experience our services. And finally, the additional funding we have secured. A corporate plan is as good as each year that's in the plan. And for the first year of the plan, I'm very confident to say the funding that we have got has been very significant. 20 billion euros, 3.5 billion extra provide us with the resources. So in closing, before I hand you back to Mark, our chairman, I just want to say again, thank you all for what you've all done during the course of last year. I believe we have a corporate plan that sets out a really good strategic vision, but is very action orientated. And it certainly makes me very proud of everything we've seen in the past year. And I think we have the wind behind us going into it for next year. Thank you.
Okay, thank you very much, Paul. So I'm going to ask people to use the web chat to submit questions, and we've a good number have come in. I'll try and use the time available as effectively as possible, but bear in mind there are going to be future discussions, conversations and consultations with stakeholders in various formats over the coming months. But our recurring question, and I think might reflect the nature of the audience out there, is in relation to Section 39 organisations. People asking, is there going to be additional funding for Section 39 charities? Many of them are very, very stretched and under huge pressure, yet there's increasing stagnation is the perception in funding for them. What have we to say for Section 39 organisations?
If I could make a brief comment, Mark, I might just ask the chairman as well, but just briefly on the funding. Obviously our funding is geared towards, the funding we know we have is firstly in the service plan. And across the board for the areas that we would engage with the Section 39 organisations in particular, we have extra funding. So a lot of our primary care services are up by 29%, 264 million extra euros invested in primary care. On mental health, an extra 83 million. It's up 8% overall. On older persons, again, where we provide services to a lot of Section 39s, up by 42%, 389 extra million euros. On disabilities, up 178 million euros, up 9%. So yes, we do have extra funding. The real challenge is, again, as we always say, how we get the best model to deliver that extra funding. Kieran, do you want to make any extra?
Let me take myself off mute. Yeah, I suppose the two things I'd add is, first of all, the co-creation thought, which was in the plan. We all read the Mary Day report. We're committed to implementing recommendations from that. But it's this idea of we have to work together to solve the problems, to create the health and care system for the future rather than the one we have at the moment. And I think all of us need to be working on that. The second thing is that in having a multi-year plan, what we're trying to do is paint the picture, which will then allow each individual organisation to know where we're all heading, and where we'd love to end up is with multi-year budgets that follow that, so that it allows ourselves, but also Section 38, Section 39s, other organisations to think ahead, and then that makes life a lot easier. Key to all of that is spending the money we've got this year incredibly well. The Taoiseach has said publicly that he would love to be able to continue this level of funding, but it depends on demonstrating the value for money. And the value for money isn't just more activity, it's the changes we need to put in place to deliver the things in the plan so that we build this great system for the future.
Okay, thank you. And I have a specific question here in relation to support for people with disabilities. The questioner says, people with disabilities have been impacted particularly severely, or many have, by social restrictions around COVID-19. Can you give a sense of this plan's overall vision, particularly in relation to disability services?
Again, I might just ask Dean to come in just and I'm happy to make some comments as well. And maybe Yvonne just to make a few from a services perspective.
Thanks, Paul, and thanks for the question, colleagues, and thank you for joining today as well. So, as Paul and Kieran have said, focusing on services for people with disabilities is one of only 6 key service objectives identified as part of the corporate plan's focus over the period 2021 to 2024. The funding of the sector issue and getting that onto a more sustainable basis has been picked up by Paul and Kieran already. There's other very specific commitments within the corporate plan as well, though, in terms of significantly increasing the number of personal assistant and home support hours, increasing and improving day services, putting in place more appropriate residential care services, focusing on community-based supports, expanding respite services and supporting the further resettlement of individuals from congregated settings into more appropriate person-centred facilities within the community. And then, if that's the plan as set out within the corporate plan, as Paul has also referred to, significant funding going in 2021 to make real quite a lot of that as well, in terms of progress on residential places, an extra 102 of those, 10,400 additional respite nights, 40,000 additional hours of personal assistance services, eliminating the waiting list for assessments of need, implementing a standard assessment tool for adults, 1,700 additional day service places. So a lot of making real on the first year's commitments within the corporate plan. So I think it's a positive story in 2021. And as I say, in terms of the priority that it has for the organisation as a whole, it's one of only 6 key organisational objectives against the myriad objectives that we could have identified for that 3-year period.
And thanks. So I'll just add, sorry Mark for crossing there, I was only just going to add to that where Dean has set out the specifics for the people who are on the call today. I think one of the critical things is the collaboration piece. Kieran set out that well at the outset as well. And most of the organisations are strong parts of our in-year planning processes, and as part of delivering on the key developments and investments that have been outlined by Dean, and that is a very sort of collaborative partnership that we welcome with the provider base and some of the specifics. And that comes back to the question, and the understandable question as well, for Section 39 organisations in relation to sort of funding, because we want to work with them around the model of service that's being provided and a sustainable funding level for that. And our engagements with those individual organisations on their plans are part of that collaboration, and we really welcome them, 39s, 38s and providers who are key to the delivery of disability services and other older person services as well. There is a very specific additional 20 million, just to add to the detail Dean outlined there. There is a specific additional 20 million in 2021 to allow us to continue with the first 50 organisations as part of the pay restoration, and then move to the next cohort, probably 100 plus. So there's some very specific funding, which I know people on this call are also interested in. So thanks for that.
Mark, can I just add one very brief comment just to that, because we all know disabilities and funding for Section 39 and 38 organisations as well has been a key issue. And as part of the corporate plan, we are rolling out an integrated financial management system, and the intention that rolls out across Section 38s and 39s. And I think the opportunity for that, as that's embraced and embedded into every organisation, is that it gives us a better capacity and insight in terms of making that case to government, being able to present it in a very coherent way. So I think its system deployment will help too as well.
Okay, thank you. I have two questions which are related, I think, in a way. They're about the tone adopted by the HSE. So the first question says, it's great to see the tone from the top as one of collaboration. How can we ensure this cascades right through the organisation? And the related question is, say that nobody denies the excellent service and care so many people receive, but for those who have a bad experience, they're often left to feel as if they are outsiders. So it's about the tone of the HSE in dealing with patient advocacy groups and others in particular.
Yeah, I think the chairman might take the second one if he agrees, and I can very briefly just mention the collaboration or the tone. It is something we're strongly committed to. The executive team, the board have had a lot of discussion around openness, how we communicate, what we value, how we engage with the public, how we engage with our staff, how we engage with our partner organisations. So it is something we're highly committed to. I think at local and regional level, there are many great exemplars of this, and we can see variations across the board in terms of some areas working stronger than others. So we want to take the best practice of collaboration. We want to know what works really well, and we want to make sure it's applied across the board. I know the chairman might want to make some comments just from his own wider experience on patient engagement and informing us.
Yeah, I think when things go wrong, certainly in my experience running a patient organisation in cancer, people want to know what happened. They're not out to blame, they just want to know what happened, and they want to know that something's going to be done so it doesn't happen again. And part of that is open disclosure, it's the attitude one has, and it's also how one looks after staff who are the unfortunate ones who were in the position where the mistake happened or whatever it is. So I think how we handle all of that is really important, because if one of the values of the HSE is that we're about learning, then that is crucial. And the other one is back to the co-creation. For me, co-creation is at its best when it has the kind of system voice in the room, and it's got the healthcare professionals in the room, and it's got the patient voice in the room, and all at the same time. So that, as Paul has been saying, sometimes you hear things that you weren't expecting. People saying the priority for me is that the service is local. It might be marginally better somewhere else, but I'd rather it was local. So I think getting all of that in place, and I know that the department has been working, as have colleagues in the HSE, on improving how we get that patient voice into policy development and then into policy implementation and service delivery from a HSE point of view.
Okay, thanks very much. A question I think probably relevant to quite a number of people on the call. How can we simplify the application process for funding from the HSE?
That's a challenge, big and open question, though.
Yeah, it is. Yeah.
I mean, one of the challenges we jointly face between ourselves and our service providers, Section 38s, 39s, is we are under significant, understandable challenge from the Public Accounts Committee, from government, around what is our oversight of spending and funding to partner organisations. And it's a very significant and diligent process that's gone through, understandably, in the audit of our accounts. And the audit of our accounts over many years, in fact last year was the first year, always had a condition on it that we have to strengthen our oversight of Section 38, 39 fundings, and so that's been a condition set in our accounts closure every year. Last year was the first year which the auditor didn't put it in. So that's the challenge we have. Equally, if we flip it around, we've heard from our service providers that the process of engagement on it it can be very clunky, can be very big overhead, and it might be the same for a smaller organisation as it is for a big Section 38 hospital. So that is part of the process of engagement that's ongoing at the moment with the Peter Cassell's group that he's chairing, to look at that whole engagement process, to look at the service level agreement between us both. How can we simplify it? But equally, it's a challenge how we can simplify it and ensure that we can give assurance to our funders in terms of where funding is going, that it is getting value for money. So we've a shared challenge in this one. We want to make it less clunky for you from what we've heard, but we equally need to do it in a way that we can give those levels of assurances. And there's no doubt the integrated financial management system again will be part of that solution. But I think the Dr. Day report, but also the Peter Cassell's now oversight of that, will bring us in a new direction. But this won't be an easy challenge. I think we all have to front up to it. We have to collectively, as the chair said at the start, demonstrate that value for money as well. Anybody else want to make a comment? Please do.
Okay. We move on. The system, so a caller says here, seemed to be very focused on acute hospitals, very acute centric at the start of COVID-19. What can we do to rebalance that?
I'm happy to call on some of my colleagues. A very brief comment. I think the general core and trust of our plan is exactly what the question is geared towards. We want to make our services, that the acute hospitals, not the first port of call. That doesn't mean that we don't need to invest in our hospitals. So I called out some figures earlier on, but certainly in terms of our acute services, we're investing an extra 800 million this year, 15% extra funds. But the one key word I would bring through our key philosophy and theme is integration. It's not about, is it a hospital system, or is it the primary system, or is it the GPs, or is it the disabilities mental health? It's about integration. And if you're any person who uses our service, you want to know where to go, and you want to know that if you're going to have another level of your service somewhere else, you need it to feel more seamless than it feels at the moment. So for me, it's not about hospitals or community. It's a real strong trust towards integration. Chair, I'm not sure, Dean?
Yeah, can I just add one comment, which is one of the bullet points in the slide was about 96 community healthcare networks, but they're multidisciplinary. So this, first of all, it's a very exciting part of the plan in itself, but the fact that these are going to be multidisciplinary, locally based, population footprints of roughly 50,000 each, that's a huge step forward. And if we put that beside GP access to diagnostics, then that helps the acute sector as well. And it means, right care at the right place at the right time, as Paul started out saying. So I think this integration message is really important. I think over time we have to be talking pathways rather than institutions more. And if we can get to that in the lifetime of this plan, we're doing a good job.
And maybe, Paul, if I could just come in there as well. I think I agree with all the points that are made. That really what we're seeing within the corporate plan is a step change towards community services, but delivered in an integrated way, organised around the needs of patients. So we know that the biggest challenges that we face as a system going forward are an increasing elderly population with increasing frailty and chronic disease. And the models that we have now with their dependence on hospital services and the absence of robust multidisciplinary community services just aren't fit for purpose anymore. So there's hundreds of millions of euros being invested this year and into next year in community services, as the chair has said, into 96 networks across the whole of the country, into 32 specialist multidisciplinary teams for chronic disease and for frailty, working together and building in the health and well-being agenda to try and provide integrated, joined-up care organised around the needs of patients, either in their home or as close as possible to their home, working in partnership with the ambulance service as well, and avoiding the need as far as possible for patients to need to go to hospital settings. So I think it's very much about integrated care, it's very much about personalised care, it's very much about responsive care. And I think it will look very different by the end of this corporate planning period than it does currently.
Okay, I'm very conscious of time is very tight. One very last one, very positive question for somebody. What can the Section 38 and 39 of NGO partners do to best support the HSE to achieve its objectives at this point?
Yeah, thank you. Go ahead, Kieran.
Yeah, I just engage with all the co-creation and the work we've been talking about, the integration that Dean and Paul have mentioned. The single biggest thing is to engage with that process, be up for the new model we will be developing together over time. And for me, that's the most important thing.
Okay, sorry, Paul, you going to say something?
No, Kieran's captured well. Look, at a strategic level, I think the process that's going on with the Peter Cassell's review, we're all engaged in that, and I think that will come out with some outcomes. But it's all about local, as we all know, and Yvonne and many of the providers who are on the line here, it's all about local collaboration and getting that culture on both sides working well.
Okay, well, listen, just to say thank you to everyone for joining us. I'll hand over to Paul and Kieran to give a very brief final word in a moment, to say again that our recording of this will be available afterwards and will be emailed to you all with a link. And as we said, stakeholder engagement has stepped up over the past year. We expect that to continue. This is just a staging post in it, and we expect to be discussing with stakeholders the corporate plan and the pathway towards achieving the objectives in it over the coming period. Thank you very much to Vanessa and Michael, our Irish Sign Language interpreters. Maybe Paul first, and then Kieran might say a closing word or two.
Yeah, very briefly. First of all, thank you for taking the time to tune into this. Everybody's a lot on their plate, and I really do appreciate it. Secondly, I think what we have all learned over the past year, if we look for the positives out of COVID, for me, it's how we've worked together stronger. I visited many of our local services, homeless, disabilities, mental health, as best I could during COVID within restrictions, and I was really inspired by the pace of which we work together, and I think it just sets a great model for us for the future. So thanks again, and I think the corporate plan sets out a direction we can work stronger together.
And for me, just to reiterate the thank you, I recognise, and the board recognises, and Paul and his team recognise, huge pressure on individuals over the last year, huge pressure on organisations over the last year, and it's been really tough. And thank you for everything that you've achieved and we've achieved together for that. And let's make sure we do even more in the future. And there is hope. It was nice to look at the COVID app this morning and see there were no admissions to ICU because of COVID. So we're moving into a different phase, and let's capitalise on that.
Okay, well, all I can say is thank you all very much for joining us, and we will be in touch with you through various forums and channels over the coming period. Thanks very much indeed.